shed of all the finance crowd, and we've had time to replace them with the public health crowd. That being the case, I'll call the meeting to order and ask the secretary to call the roll.
Ryan,
Here.
Parker. Here. Barnett, Blackman, Blackwell, Blunt, Kaufman, DeBar, Fillingane, Frazier, Harkins, Hobson, Horn, McMahon, Parks, Polk, Tate, Wiggins. We have a quorum.
The first item on the agenda is item 2068, Psychology Interjurisdictional Compact. This is a bill by Senator Younger. He tells us that it would help in particular in providing services at military bases. A large number of people move in and out there, so he says. I've looked at the bill. I can't find a snake in it. I would suggest to the committee that the prudent thing to do is to put the bill on a calendar with a reverse repealer. And once it gets on the calendar, we'll have even more people looking to see if there's a snake there. Senator Johnson moves title sufficient to pass. Senator Johnson moves that we amend the bill with a reverse repealer. Are you ready to vote on the reverse repealer? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senator Johnson moves title sufficient to pass committee sub. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2316 is an attempt to provide some help to small hospitals, and it deals with the recurring concept of any willing provider. Insurance companies in the world that we live in, whether we like it or not, insurance companies negotiate rates with hospitals. And that is one of the few ways that we have for private insurance companies and those who are buying private health insurance to have any sort of cost control on the cost of medical services, or at least that's the theory. And so effectively, if you're trying to get a hospital into your system, you're dealing primarily with large hospitals who have chains who you would negotiate rates with. What this would do is it would apply only to hospitals located in municipalities of 10,000 or fewer. And it would say that those people could be any willing provider in any contract. I believe it to be the case that the impact of this on the way the negotiation between hospitals and health and insurance companies work would be de minimis. And it would provide some benefit to the small hospitals. We're all trying to find ways to help. Having said that, I'm sure this is much more difficult than it appears to me. I would suggest to the committee that once again, if we could adopt a reverse repealer and put this bill on the calendar, it would focus the attention of those who might be able to point out more difficulties with this situation. So having said that, Senator Johnson moves title sufficient to pass. Senator Johnson moves that we adopt a reverse repealer. Senator McMahon.
I have a question.
Yes, sir.
I really support this type of legislation. And why are we limited it to just the small counties? Why can we not open up to the entire state and allow all health providers to be providers, any willing provider?
Because then there's no more negotiation about rates. Why would any hospital negotiate a rate when all the hospital has to do is sit passively by and just pay the highest rate?
Well, it's my understanding insurance companies have rates that they'll pay. And if a medical provider is willing to accept that rate, then that's any willing provider. Do I misunderstand that?
I think you've defined the concept of any willing provider. But the insurance company at that point has no ability to negotiate a rate with a provider. Why would I give you a lower rate when all I have to do is sit passively and I can get a higher rate?
Aren't many of the rates set by Medicaid and Medicare in comparison? That's the comparison rates.
We can't control the rates on Medicare and Medicaid, and those rates don't apply to private insurance.
I'm gonna ride with you today, but I am gonna have some questions on the floor. Thank you.
Okay, anyone else? There's a motion entitled sufficient to pass committee sub. Are you in favor? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. We have Senate Bill 2485. Which does a simple thing. It adds, there's one word on line 88. Individuals who hold a degree in human development and family science or child and family service with a concentration in child development and licensure in pre-kindergarten to kindergarten, to the very long list, and you can see this is M, so there are 12 others of those who can provide early intervention services. It seems odd that this one particular group has not been in the list, and so that's what the bill does. Is there a motion title sufficient to pass? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I believe we had from yesterday's hearing a proposed committee sub to do a study committee. Did that get passed out yesterday? Okay, so I've already done that. Thank you. I'm just trying not to get us too far afield. Senate Bill 2575, taking that out of order, is a bill which would allow entities which are licensed by the State Department of Health to be recognized as providers under insurance policies, just as we did for those for community mental health centers last year. There seems to be some concern that the language in the bill is overbroad, and those who have concerns about the bill, who've talked to me, say they would be content, once again, if we added a reverse repealer to the bill, and that would give us some time to get together with the Department of Health and the insurance companies and see what the concerns were. So having said that, Senator Johnson moves title sufficient to pass. Senator Johnson offers a reverse repealer. You ready to vote on the reverse repealer? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. And now Senator Johnson moves title sufficient to pass committee sub. All in favor say aye. All opposed, no. The ayes have it. Senate Bill 2574 is a bill from the State Department of Health. I believe we have somebody here from the Department of Health who might be able to speak to us. This deals with the department and the facilities at county levels. Is either of you, any of you from the Department of Health want to hold forth on this one? I just think Mr. Craig knows more about the specific circumstances and what's led to the bill than I. So, Mr. Craig, if you could help us out, you're recognized to speak.
Thank you, Mr. Chairman. Appreciate the opportunity. I'm Jim Craig, Senior Deputy at the State Department of Health. This bill is really to allow the State Department of Health to set some minimum standards for health and safety of a health department, a county health department. As you know, county health departments are buildings provided to the State Department of Health by the county. The State Department of Health provides the actual staffing for those facilities. This would just allow some minimum standards to be established for those county health departments around the state.
As I understand it, the problem is that in some places, the facilities that are being provided are just completely unworkable. And this would allow the department to set standards for if you're going to have a county health department, your building has to at least be up to this level.
Yes.
Am I saying that right?
Yes, sir, that is correct.
Any questions? Senator Hobson?
Thank you, Mr. Chairman. Dr. Craig, the language would seem to indicate that they also are required to expend local funds, appropriate and expend local funds from available sources for the construction, equipping, et cetera, for the facilities. If they say that they don't have funds available at that time, what's the alternative?
Other than coming back and ask the legislature for some additional appropriation, there is no requirement that they would have to do anything other than meet the standards. But the department would have the opportunity to look for some additional ways to maybe even help them find funding. We've been able to do that through some grants through the WIC program right now to assist some of the county health departments in some of those remodels.
Well, look, I'm fine with the premise. The language would indicate that they would be to appropriate and expend local funds from any available source. Are you getting any pushback if the supervisors weighed in on this? Are they concerned that they may not have the resources at a particular time to do what's being requested here?
We've not had any feedback from the supervisors on Supervisors Association on the bill, sir.
I'm just trying to head it off at the pass. It looks like I could see where they might say, well, look, it's fine, but we got money we got to spend on these other things and we can't put it in this facility. Not that I wouldn't necessarily agree. It would depend on the circumstances, but I just don't want to end up back here next year with some fight over how this is going to be utilized. And if I'm misunderstanding it or misreading this, please correct me. Thank you.
Senator McMahon?
Thank you, Mr. Chairman. Dr. Craig, thank you for being here today. You're one of my favorite government employees. I tell you, you are a wonderful bureaucrat. I mean that in a term of endearment. Seriously, you return every phone call, email, and inquiry, and I appreciate that. I really do. So that was in no way a slight towards you. I do value you as a state employee, and I'm appreciative. I have a question. So I'm finding a little humor in this. So you're sharing with us as the agency for public health that y'all don't have any ability to govern the county public health facilities?
So the county health departments are buildings of county government. They are not state buildings. So the county, to have a county health department, the county provides the building. And sometimes they provide some subsidy that goes with it. Sometimes they also provide some services for that building. And the state provides the staffing and the coordination of care for those county offices.
But it's within your agency's authority to condemn any facility as well, isn't it?
Usually condemnation is done at the local level, not at the state level.
Okay. I just find some humor in this, as I'm sure you do as well.
But we have quite a few health departments that they don't really meet, the county health departments that don't meet federal minimum requirements to even.
Can you give us an example?
So the HIPAA compliance of being able to have a conversation like you see in most clinics when you come in and check in, that you can go through your billing processes and all your HIPAA compliant conversations.
Can you give us an example of a facility that you think is not up to standard?
We have many facilities in the state that are not up to federal standards, sir. Quite a few.
So this is an unfunded mandate, what it is on the counties. They provide a space, but it may not be to what your agency prefers.
well, it could be seen as an unfunded mandate, but I don't know that there's a requirement that they have to make a change to the building in this bill. It just lets the health department create some rules and regulations or minimum standards of what a health department, county health department building should have to provide services.
All right. Thank you.
Thank you. Anything else from Mr. Craig? Thank you, Mr. Craig. Anything else from members of the committee? Is there a motion, title sufficient to pass? Are you ready to vote? All in favor, aye. Opposed, no. It appears the ayes have it. The ayes have it. Is there a motion to rise and report? All in favor, say aye. All opposed, no. Ayes have it. Thank you. Thank you for coming. As always, thank you for your hard work.